Hope you and your loved ones are staying safe during this difficult time. As the lockdown continues, it's become clear to me that many people are struggling with their symptoms, mobility and their general health. Whilst we know it's important, the importance of respecting the lockdown to protect the country and the NHS, it's also really important that everyone continues to have access to the best possible healthcare. As such, I want to let you know that we are reopening our clinics on the 11th of May. We are working with the latest government guidelines to make sure our clinics are safe for you and our team. We've been provided with PPE, we have specialist cleaners, we have new procedures and social distancing measures in place. By helping our patients get out of pain and staying well, we're doing our part to take the pressure off the NHS. The NHS is going to be playing catch up even as this pandemic eases, and the best way we can help them is by looking after your health. One of the most important reasons why the government has made it clear that you can travel to healthcare appointments during this lockdown, which of course is including visiting us. I'm going to talk you through what to expect when you next come in, so please watch this video to the end before your next appointment. First, please do not come in if you've had any symptoms of COVID-19 in the last 2 weeks, such as a new persistent cough or a high temperature, or if anyone you have been in contact with has had these symptoms. Please follow the government's advice on isolation and let us know, and we'll look forward to seeing you when you're not an infection risk. Whilst we always welcome families, unless your family members are being adjusted as well, where possible we would ask you to come to clinic alone. We want to maximise social distancing for everyone. So, please don't arrive early, please arrive on time. You may be asked to wait outside under the shelter, similar to when you're visiting the supermarket. We will have social distancing markings in place. When you come in for your adjustment, as usual, if there is no significant changes that I need to be made aware of, please sign in using the iPad. And now there is an alcohol gel right next to it we recommend you using it immediately afterwards. If there is significant changes, which we need to know about, such as your worsening condition, any accidents, any injuries over the last 6 to 8 weeks, please ask a member of the reception team for a form so we can record this and put this in your file. The clipboard and the pen will be wiped down after your use. You notice that most of the chairs have been removed from the waiting area. We will have some chairs available for you if you need to sit, but it's best to avoid touching as many surfaces as possible. The socially distant areas will be marked on the floor. Then, the reception team will direct you to, when it's time, will direct you to the adjusting area. As you can see, we're going to just be using 2 benches, and the benches will be thoroughly disinfected between each patient. And through infection control measures, we're using hand gels, gloves, we'll be having aprons on and also masks as well, to ensure your safety and our safety. When you come into the adjusting area, please, if you have any belongings, please place them on the chair, which will also be disinfected. Also, you can bring in yourself a bag that you can put your bits and bobs into a bag as well, so it's not a problem there. Rather than lying down on the bench, I'm going to ask you to sit instead, and then we'll be adjusting you as normal, okay? If you feel more comfortable wearing a mask, or if the government guidelines suggest this, please do so. But as a record, you do not have to do this. After you've been adjusted, please go to reception. Most of our patients are on care plans, so there's no need for payments every time you come in. But if you are paying per session, please use card or contactless. The contactless limit has been raised to 45, so it should cover all the pay per session plans. If you were to buy a care plan, this can be done using the card machine, which will be disinfected, or if you would prefer, we can arrange this over the phone. Most of our patients have their future appointments booked in, but if you haven't, please discuss this with the reception team, who will happily help you with this. If you have any questions regarding any of this, please feel free to get in touch by phone or by email. I know how important your chiropractic care is to you, and we're doing everything we can to make sure you have your appointments you need while staying safe. I've had lots of patients emailing me about referring their friends and family as they are struggling through these unusual circumstances. So yes, of course you can. Please remind them to let us know that you've recommended them, so they can get the complimentary consultation as per usual. If you haven't got your next appointment booked in, please get in touch and we'll arrange that for you. We are very busy over the next couple of weeks, so I've included a few extra appointments for you. I'm really looking forward to seeing you guys, and I look forward to seeing you next week in clinic. Stay safe.